Physiotherapy after surgery is important. On this DVD there are instructions as to how you might perform exercises for the area in question. You should look at these exercises, and generally we will have already shown you how to do this. But the images that we've given you on this DVD should allow you a greater facility to perform those exercises. Please make sure that you do the exercises regularly, at least on an hourly basis, as you will substantially benefit from this. You should also use ice regularly, and the ice packs that are given to you at surgery or before should be used on a regular basis. Generally, after we've done a surgical procedure, we don't need you to see your own physiotherapist for about a week, often until we see you again in the office. You do, however, need to maintain the exercises that we've shown you. You need to elevate the limb, which generally means putting your foot above your buttock so that the water in the leg can drain downhill. Ice is crucial, and as mentioned, you need to use this a lot. We will generally provide you with ice sleeves at the time of the surgery or before, and the idea of these ice sleeves is for you to apply a very effective cooling mechanism to the limb in question. You must use these as much as you can. The first time you need the ice sleeves, they need to be put into the freezer of your refrigerator for about an hour. They can then be taken out, inserted into the sleeve, and used for a 15-minute period. Their efficiency will drop off during that time, and they need to be popped back into the freezer. They can be used again in about an hour. Ice is very effective for pain relief, and it's also very good at keeping down swelling. When you come back to see us in my office, we will do a number of things. First of all, we'll explain to you what the surgery involved. We'll tell you if there were unexpected findings, and we will generally reiterate what we've already told you at the time of surgery. Many people don't remember what happened to them in the hospital, certainly not in detail, and we'll try and fill in the detail for you. We may take the dressings off if they haven't already been removed, and in particular in foot surgery we will take off the dressings, inspect the wounds, generally not take out the sutures, and then put some more dressings back on. We will make arrangements for further treatment as that is required. We will also send a letter to your general practitioner or to your referring practitioner so that they know what we've done. We will give you certificates for leave, and if you need further certificates, or if you need them more quickly than when we first see you, you should let us know. There are three basic types of knee surgery that I would like to discuss. The first is knee arthroscopy. Arthroscopy is a process by which the surgeon introduces a telescope into the knee. By so doing, the surgeon can visualize the inner aspects of the knee, identify problems that exist in that knee, and then deal with those problems. Arthroscopy is a very successful procedure, particularly if the procedure is chosen with care. It is a simple operation, often being done only as a day procedure. It is done generally under general anaesthetic and uses a telescope. Once I've seen the structures in question, we will deal with whatever pathological problem you have. I might remove a small piece of damaged cartilage. I might take out a loose piece of bone. I might even perform a knee reconstruction, which can effectively be done in this keyhole manner. And there are many other things that we can do. Why might I talk to you about a knee arthroscopy? Generally, you would present with symptoms of a cartilage tear, a loose body within the joint, maybe early arthritis, maybe some kneecap problems, and sometimes pain that we can't explain. Some people ask why it is that they have not completely recovered after knee arthroscopy. The main reason for this is that there may be coexistent osteoarthritis of the knee. This is simple wear and tear arthritis and is much more common than you might think. It is particularly common in middle-aged persons and often presents without obvious injury. If there is arthritis in your knee and you have a knee arthroscopy, you may find yourself not completely cured. Many people will, however, find substantial benefit from arthroscopy. If I feel that your arthritis is advanced, I may not recommend arthroscopy. On the contrary, occasionally arthroscopy can be contraindicated. And if this is the case, and if I feel that it is not in your best interest to have an arthroscopy, I will clearly tell you this. A cartilage tear is a common issue. When looking inside the knee, the cartilage is the spacer that exists between the thigh bone and the shin bone. People who present with symptoms of a cartilage tear often have no history of injury, and this is particularly so in older age groups. The pain is not like anything they've experienced before, and they're generally able to localise the pain with one finger to a particular area of the knee. The pain tends to persist. It can fluctuate in intensity, becoming better and worse, and sometimes it feels like it's going to get better, only to get worse again. Usually, it can be well localised to a particular area of the knee. Sometimes there's swelling, but this is not essential. Nighttime pain is common, and people say that they find it difficult to sleep. Some people also find that putting a pillow between their legs makes them more comfortable. Physiotherapy can offer some benefit, but if you have a substantial cartilage tear, it isn't likely that physiotherapy on its own will rectify the problem. Fortunately, the surgery is very effective, and if the problem is of a cartilage tear, then you will find that the surgery should resolve the issue that you have. The surgical outcome is very good in the vast majority of people, and generally speaking, if you present with symptoms of a cartilage tear, we will without much hesitation recommend the surgery. The reason we do so with such confidence is that we know with a fair degree of surety that you won't get better without the surgery. People often ask us when should they have the surgery, and this is generally speaking a question that answers itself, as the pain will not resolve without surgical treatment. Sometimes, particularly if you are reluctant to proceed to surgery, we may offer you a physiotherapy course or perhaps an injection. If you decide that surgery is necessary, and if Dr. Miniter agrees with you, then we will find a surgical spot for you in the near future. Arthritis of the knee is a very common condition, and increasingly so. It often presents over a long period of time, with a gradual decline in function. Many people find that as they get into their 50s, their weight somehow increases. Often with that there is pain in their knee, and then they find that they can do less exercise, so their weight goes up further, which further diminishes their activity levels. If you've had a slow decline in function, with an increase in knee pain over a long period of time, it might not be that arthroscopy is recommended for you. On the contrary, it might be better for you to have physiotherapy or an injection. In some people, there is, however, a precipitous decline in function of the knee, and if this is the case, it may be due to a new cartilage tear, to the dislodgement of a piece of bone or cartilage, or something like that. And if your condition has changed a little while before you come to see me, it is likely that you will benefit from arthroscopy. If arthroscopy is not likely to help you, we might say that arthroscopy is not recommended. In that context, we might then be talking about a joint replacement.